All right, folks, we're going to get started, so if you can please take your seat, that would be very much appreciative. Thank you. Oh, that was a lot faster than I thought.
That happened quick.
Okay, let's get started then. Good morning and welcome everyone to the 2025 Infoway Partnership Conference. I'm Edwin Chacon, and alongside me is the one and only Krista Balenko. Together, we'll be your co-MCs, or as we like to call ourselves, your interoperable hosts.
Thanks, Edwin. Bonjour tout le monde et bienvenue à la conférence du partenariat 2025 d'Inforoute. As your hosts, we promise seamless coordination, minimal downtime, and only the occasional system glitch, otherwise known as Edwin's jokes.
Whoa, okay. I like to think of my jokes as pilot projects, still in testing, but full of potential.
Okay, sure. Anyway, we're so thrilled to have you here in beautiful Quebec City for 2 exciting days of insights and inspiration, all taking place during Digital Health Week, Canada's annual celebration of digital health and how it improves the lives of Canadians. Bienvenue à Québec pour 2 jours d'échange, de réflexion et d'inspiration pendant la semaine de santé numérique.
And this year's theme says it all. Accelerating connected care, innovation, driving progress. During our time together, we'll dive into everything from AI and the future of primary care to building trust in health data and advancing interoperability across Canada.
So whether you're here to talk data standards or conformance or finally meet that person from your last 5 Teams calls, this is the place to connect, collaborate, and recharge.
So welcome to Partnership 2025, where every idea and innovation moves us closer to better, more connected care for Canadians. And as such, let's kick things off by recognizing the leaders, partners, and innovators in this room today, all of you shaping Canada's digital health future, with a big round of applause.
Now for a little bit of housekeeping. Sessions in the main plenary room and the concurrent sessions will be held in English or French. Attendees can access simultaneous interpretation services through their mobile phone by scanning the QR codes that you see here. And please remember to bring your own earbuds if you forgot them at home. There are a limited number of rentable ones. You can just bring your ID to the registration desk. I think it's just at the back. Finally, we're also excited to offer live captioning in English and French for the plenary sessions, as you should hopefully see on the screen. Perfect. If you have any questions about that or need any support, Infoway event staff should be around the conference. Alors, les séances se tiendront en français ou en anglais. Nous sommes également heureux d'offrir un sous-titrage direct en anglais ou en français.
Before we go any further, Canada Health Infoway acknowledges that we are gathered today on the traditional territory of the Wendat Nation, whose presence here dates back millennia. We also recognize the standing relationships of neighboring First Nations, including the Innu, Abenaki, and other Indigenous peoples who have lived, traveled, and cared for this land since time immemorial. We honor their enduring contributions, their histories, and their stewardship of the lands and waters we share. We honor the enduring relationship that Indigenous peoples maintain with this land and the wisdom they continue to share about healing, balance, and the interconnectedness of all life. As an organization committed to improving health and wellness for all people in Canada, Infoway recognizes that reconciliation requires ongoing learning, collaboration, and respect. We're grateful here to meet in Quebec City, and we reaffirm our commitment to building partnerships grounded in trust, inclusion, and shared progress. I'd like to now welcome to the stage Indigenous Elder Marcel Godbout.
Kweweti, Wendake, Hosha Hankiatsi, Handiawishi Waitukutan Wendat Endi, Enjuan Tate, Quatatiata, Yari Wahye, Wendat. Wendat iyon went sutta. I don't know if you translate there. No, no translation. Oh, excuse. So I just make some words in my language, in Wendat language. I suppose to speak in French. Huh? It's because of the warm-up of the morning. No, I make a joke. It's because actually I speak all the time in French. So it's why I... But for my presentation this morning, for the opening, I will prefer to speak in French. Excuse me, but it's better to have the good words for you. It's better to use the words that come easily for me from my mind and also my heart. So when the language, it comes more easily, you could have the good words to express to people. So it's why I prefer to speak in French to you and to receive you by this language, because nobody can translate in Wendat today. So. OK, alors ce que je me présentais tout à l'heure, alors mon nom c'est Marcel Godbout, mon nom traditionnel c'est Chacon, j'appartiens au clan de la Tortue. Chez nous, je vois plusieurs dames ici dans la salle. Pour nous, c'est un honneur. Les femmes sont très importantes dans notre communauté. Nous sommes basés sur un système qu'on appelle le matricentrisme, ce qui veut dire que la femme est au centre de notre société. Donc, pour différentes raisons, les femmes sont très importantes pour nous et elles sont à la base traditionnellement de plusieurs choses chez nous, chez les Wendat. Tout comme nos frères et sœurs, probablement que plusieurs ont entendu parler des Iroquois, qui, dans leur propre nom originel, est Haudenosaunee, qui veut dire les gens qui bâtissent des maisons longues. Donc, pour eux, c'est la manière de se nommer. Donc, ils ont une tradition qui est similaire à la nôtre aussi, ils vivent de la même façon. Donc, tout à l'heure, quand je vous accueillais avec mon nom traditionnel aussi et le clan auquel j'appartiens, c'est vraiment important. Donc, j'appartiens à la nation Wendat également. Donc, si vous voulez venir nous visiter, notre communauté est seulement qu'à 20 minutes par l'autoroute. S'il n'y a pas de trafic, c'est merveilleux. Donc, vous pouvez venir chez nous. On est très accueillants. On a un développement économique très, très aussi développé chez nous. On est des gens... Notre nation a toujours été une nation très dynamique et aussi une nation qui a toujours été reconnue au niveau du développement économique également depuis la nuit des temps. On a toujours été considérés comme de grands orateurs, les Wendat, mais aussi des personnes qui travaillaient beaucoup au niveau du commerce. On disait souvent à plusieurs moments que les Wendat, que la langue même de commerce ici sur le territoire était le Wendat pour pouvoir commercer dans l'Est de l'Amérique du Nord, dans la région des Grands Lacs. Notre territoire s'établit ici le long de la vallée du Saint-Laurent et tout le long jusqu'à la baie Georgienne. Finalement, le lac Huron a été nommé justement en fonction de notre peuple. Si vous voyez le terme Huron, c'est le terme dont les Français nous ont donné à cause de la bande de cheveux qu'on avait ici qui était noirâtre, qui ressemblait à ce qu'on appelle un mot français qui est la hure, H-U-R-E, qui symbolise, si vous voulez, le genre de coiffe hérissée du sanglier en Europe. Donc, parce que les hommes se coupaient, rasaient les cheveux de chaque côté de la tête, il y avait comme un genre de bande noirâtre ici de cheveux jusqu'à l'arrière. Donc, c'est la raison pour laquelle on a porté le nom Huron longtemps, que les gens nous donnaient ce nom-là. Mais notre nom à nous, originel dans notre langue, c'est Wendat, et l'endroit où l'on vit, c'est Wendake. Donc, ça nous fait plaisir, c'est un honneur pour moi ce matin. Je remercie l'organisation d'avoir eu la délicatesse de penser aux Premières Nations et de penser à notre nation en tant que telle aussi, de la représenter, d'être présent aussi, de vous accueillir sur notre territoire. Donc, on est content que vous soyez ici sur notre magnifique et beau territoire. Vous allez voir l'excellente vue sur le fleuve Saint-Laurent si vous allez sur la terrasse d'ici. Vous allez voir les merveilleuses montagnes et le long du fleuve, les magnifiques terres, les terres sur lesquelles on vivait, dans des villages qui étaient regroupés, où il y avait plusieurs maisons longues. Et dans chaque maison longue, bien, c'était la maison des femmes. Donc, exemple, dans une maison longue, c'est la maison des tortues. Ben, tout exemple, ma mère avec ses sœurs, ses grands-mères, les aïeuls vivaient dans cette maison-là. Évidemment, il y avait des hommes, mais les hommes devaient provenir d'un autre clan. On mariait toujours une femme d'un clan différent pour nous. Donc, c'était nécessaire pour éviter pour la consanguinité, pour le sang, finalement. Donc, c'était traditionnellement pour nous, c'était quelque chose de vraiment important. Ça faisait partie de nos coutumes. Ce matin, pour l'ouverture, je vais vous dire quelques mots en Wendat, dans notre langue traditionnelle. Et ces mots sont des remerciements à la création, tout simplement. Donc, c'est important pour nous. Juste durant ce moment, si on filme, peut-être de ne pas filmer durant ce moment, de prendre des photos, s'il vous plaît. Donc, après, je pourrai vous expliquer. Et il y aura un lien, évidemment, avec ce que vous faites aujourd'hui, toujours, évidemment. What is important for you traditionally is to make what we said, Thanksgiving address. A Thanksgiving address is very simple. It's a moment that we take together just to make in place a kind of environment that could be nice to be together. And this kind of moment is also to make the relation that is very important for each of the relation that we have around the creation, because the creation is very diversified. We're different relation with the environment, with the nature, the Mother Earth, and what it lives on is not just with human beings. The relation is with the plants, the trees, all the living things around us. And when we do this kind of things, it's very important. It's because it's a kind of remind, a kind of memory that we have to do. Because when in the morning when we awake, we not always think that when we think the water and we drink water, oh, it's good, thank you for water. We just drink automatically because it's so easier to have water or other things like this, or we go to the refrigerator to take some food or meal, and it's like free, it's easy to have. And we don't take the time to say the thanks to have this, thanks to all the elements come to nourish our mind, spirit, and heart too. So it's why we use these words before, just to make a kind of remind that these things is very important for us. If we don't have this kind of relation, between all the elements of the creation, that is very important for our life. So something missed to our life. We don't live anymore. So it's why we have to, for us, for our people, it's why we use these words before. It's to remind that we're just human beings and we need all the relation with all the creation around us. And it's a time to say thanks. It's the first purpose. And the second one is to encourage all these elements to continue to live like human beings, women, men, and all the human beings who have, all of us have something to do in our family, our community, here in your partnership. You come here to bring something, huh? And for us, what is important also to present, to finish the opening, is to say that in the end, in my language, what I said is to just to explain all, to say thanks, encourage all the different elements. We just begins with what is very close of us, and we finish what is very further of us. And first of all, we say thanks to the human beings of our people, the women and men, but also for all the human beings in the world, women and men. For you too, you include in this. And also we say thanks to all the Mother Earth and what is live on. So the medicine plant, you talk about medicine, you talk about the communication, how you can help, the people for the transmission, of the communication could be easier to help the people, the human beings. But when you use medicine, it's important to use the medicine also come from the plants and the trees, and different molecules come from the creation too. So we have a thinking of that, and also all the, the different animals and the birds, and also different element of the creation, like the force of the winds, and also like the sun, the moon. It is very important. It's a feminine, energy. Like for the woman here, it's a link with the woman. We say grandmother moon for us. It's very important. And at the end, we say thanks to the Creator. And the first thing that the first teaching that we have now, we know, everybody knows that now we are on the era of to have rights. But before rights, we have responsibilities. And sometimes it's what it means. Everybody wants to have rights, but is it everybody wants to take their responsibility? Is the first learning, teaching that we try to bring, to transfer to the young generation, to say that we have a responsibility to each of one. After that, we have a right. But first one is a responsibility. And to the end, to finish, the words that they say at the end is, now we are one mind. One mind means that everybody is similar. We have to be the same. No. It means just we are together with our faults, our weakness, but also our force that we bring to the circle. Like here, you will work together for 2 days. You will work in one mind. It means that in one purpose, in one goal. What goal? One goal is very important, together. But each of one of all your own knowledge, of your also your abilities, capacities, and all the things that you can bring to each of one, and also for the people, for the human beings, to make a better world. So it's the word that I want to let you today of our nation. Thanks a lot to invite the spirit of our nation too. And I want to share to you that you have a good day. Continue to have a humor. You use humor. But for us, humor is a kind of medicine, because when we laugh, we feel better. And to feel better with laughing is a kind of medicine. When we have to cry, pleurer, yes, to cry is also another medicine. It's because it's good to the emotion that you have to let it go. Thanks a lot. So it's important for that, and it's one I want to share, is to make one together today, and to have a good partnership today for better life for the human beings, to be sure that we have a good medicine for all the people, but not just the medicine of the body, but the medicine of the mind and the medicine of the heart, the emotion. all together, we say a word in our language, we say askenonia. It means now we are in a good mind, we are good. Say askenonia ies, say askenonia hies. It means now I feel good in my spirit, my heart, and my mind. It's what I want to let you today, and I will come back tomorrow for the closing. Have a nice day. Tiawakine aweti yo.
OK, bonjour et bienvenue dans la belle ville de Québec pour la conférence de partenariat 2025. Je m'appelle Michael Green, je suis le président de Infoway depuis 10 ans. Tout d'abord, je remercie Marcel Godbout de cette touchante prière d'ouverture. Thank you very much for the kind opening, Marcel, and we look forward to seeing you again tomorrow. So great to be here in Quebec City, and it's very seasonal. I think we laid on the snow, especially for you guys. And, it's wonderful to see so many familiar faces. We've got a great crowd here for the next couple of days. And, we're particularly proud to host the conference here. We have a lot of collaboration in the province of Quebec. It's a very important province for us, and we've worked on many kind of programs together over the years, and certainly look forward to doing so in the future. The theme this year for the conference is Accelerating Connected Care, Innovation, Driving Progress. And this really reflects the shared belief that we have that progress happens when technology, trust, and teamwork all come together in the end in the service of patients and also, importantly, their providers. So partnership's been, at the heart of Infoway's mission. I think we've run this conference for a number of years now, and each year I think it gets more interesting and kind of bigger. And I always look forward to the conference season. And I think whether you're involved in, developing pan-Canadian standards or, the secure flow of health information, or if you're supporting innovation in care delivery, we know that none of this work can be done in isolation. And our success really definitely depends on collaboration of a lot of different organizations and people, governments, vendors, clinicians, patients, Indigenous people, communities, and many more working together to transform the health system. Today, we want to celebrate these partnerships and the collective progress we're making towards a more connected, equitable, and sustainable health system for all Canadians. I think one of the most palpable examples of this collaboration that Infoway is especially proud of is our AI Scribe program, which was launched to really help alleviate the administrative burden for clinicians and give them back time. And over the past year, we've seen this program grow from the early pilots that were run into a national initiative that supports real-world clinical adoption of responsible AI tools. Working closely with federal, provincial, territorial partners, as well as pre-qualified vendors, this program is demonstrating that AI adoption in healthcare can be done safely, securely, effectively, and also will be kind of grounded in clinical need. Within the first month of being live, we saw more than 10,000 primary care clinicians across Canada register for the program, and by the end of August, 86% of deployed clinicians were already actively using the tool, which is phenomenal for any kind of new program. And moreover, the survey results that we have from the early adopters do point to significant impact at the front lines, and I can share some of these with you now. 94% of clinicians report time savings, with 62% saving more than 30 minutes a day. More than 80% also note reduced cognitive burden and administrative workload. 93% say they feel more present with patients during visits, and the enthusiasm from clinicians across the country has been inspiring to us all. Early results show measurable improvements in reducing administrative burden and also returning valuable time back to patient care. Further, our partnership with industry remains a cornerstone of digital health transformation. Through our vendor innovation program, we are identifying and accelerating integrated, forward-looking solutions that will help advance connected care, improve patient access to their health information, and also enhance care coordination across the Canadian health systems. This year, 8 winning projects will compete in real-world demonstrations in Alberta, British Columbia, Ontario, New Brunswick, and Nova Scotia, and 2 projects focused on pan-Canadian healthcare systems, including one which places special emphasis on Indigenous and rural health systems in Alberta. These partnerships are laying groundwork for a truly interoperable, vendor-ready ecosystem, one that fosters innovation while improving trust and efficiency across the country. As part of our ongoing commitment to advancing clinician-led innovation, another highlight this year has been our Centre for Innovation in Digital Health, CIDH, and specifically the program's clinical grants and scholarships. The 2025 Connected Care Innovation Grant received over 180 applications, and the winning projects span a wide range of clinical settings across the country. This work is also a testament to what innovation in healthcare can achieve when it's driven by those who are closest to patients and the communities they work in. I want to recognise all the CIDH recipients, some of whom you can meet at the conference this week, and our patient partners who are here with us this week as well. Your insights, advocacy, and lived experience keep us grounded in what truly matters, which is improving care for people. Finally, we're also excited to be bringing back some of our most collaborative events, creating space where the public and private sectors can work together, non-competitively as well, to advance connected care. Namely, this is Infoway's Pan-Canadian Projectathon, which will be returning in 2026 and taking place virtually from February the 24th to the 26th. It's going to provide a valuable opportunity for jurisdictions, vendors, and developers from across Canada to test and validate their digital health solutions against pan-Canadian specifications. This ensures alignment with national standards and also helps to accelerate the adoption of interoperable systems nationwide. We have much to be proud of and even more to look forward to, but I must acknowledge that none of this progress would be possible without your partnership. Infoway would like to recognise the incredible collaboration and trust we built with our federal, provincial and territorial partners who continue to align around shared priorities for interoperability, data portability and innovation. We look forward to continuing to advance national health priorities, including improved health data exchange, expanded access to information and accelerated interoperability nationwide. I want to thank our vendor community for your continued leadership and investment in building solutions that meet national standards and also address the real needs of patients and providers alike. To clinicians across the country, physicians, nurses, pharmacists, and care teams in every setting, thank you for embracing digital tools that support better, safer, and more efficient care. Your willingness to innovate, co-design and lead ensures that technology truly advances the care experience for both patients and providers. To our Indigenous partners and communities, we are grateful for your ongoing collaboration and guidance. Your leadership reminds us that reconciliation and digital equity must be central to Canada's health transformation. We're honoured to walk this path together and to continue learning from Indigenous knowledge and perspectives as we shape the future of connected care. To our patient partners and caregivers, thank you for reminding us that technology must always serve people, not the other way around. Your insights, your lived experiences and advocacy also keep our work grounded in what matters most in improving health and care for everybody. As we begin this year's conference, I encourage everybody to listen, share, and challenge ideas together. Yet let's use these next 2 days to learn from one another, to spark new collaborations, and to reimagine what is possible when we work as one. Connected care is not a destination. It is a journey we're on together, and I'm confident that with the dedication and creativity in this room, we will continue to move Canada forward. Merci de votre présence, de votre dévouement. Je vous souhaite donc officiellement le bienvenue de part de Infoway. Thank you very much. Thank you. And now I think we have a short opening video. Thank you. Hi everybody, welcome to this year's Partnership Conference 2025 in Quebec City. Really pleased and delighted to see you all here. This is a really important conference because we're trying to promote connected care, and the only way we can do it properly is to partner with all of you. It doesn't matter whether you're a patient, whether you're a provider, whether you're from a health ministry, or whether you're working for a commercial company or vendor. We all know that we've got a significant role to play. We all need to work together as a team to make it happen.
Infoway takes the quintuple aim of Canadian healthcare system to its heart: improving population health management, providing patient experience and care, improving providers' experience, improving cost to deliver healthcare services, and providing health equity. All these 5 aims are rooted into the work that we do on a day-to-day basis.
Infoway is a key convener and catalyst of partners who are contributing to the gradual digital transformation of our healthcare system. On the one side, we work by establishing national health data exchange standards. On another side, we engage with clinicians and patients with regard to new novel technologies that may be enhancing care and are also tied into digital health standards.
One of the programs that my team and I are extremely proud of is the AI Scribe program for a few reasons. Number one, first pan-Canadian program where all the jurisdictions came together. Second, we were able to run a very efficient process within 3 months, and the early results from those are fantastic. Not only it's helping them bring down the administrative burden, but it is actually creating a very enhanced experience both for patients as well as for the providers.
One of the initiatives that has shown some great success is Center for Clinical Innovation in Digital Health, the CIDH. The idea behind this program was to directly engage with frontline clinicians to support them on ideas that they might have that could solve real-world problems at the point of care in a clinical setting, at the same time reduce their administrative burden, improve care for patients, and also tie in improving standards-based interoperability and data quality.
It's really important that we all partner together to get this agenda on the go and get it really moving in the future.
Bringing us all together under one tent to really work together towards advancing common goals in digital health transformation in Canada.
And the only way we're going to do that is working together with our vendor community, with the public sector, with the healthcare professionals that are delivering care, and also importantly with patients. So I think that's really the message I want to send out, is one of collaboration going forward.
I'm really delighted to see you all, and thank you all for coming to this annual Partnership Conference 2025.
I'd really like to thank you all for participating in the Partnership Conference 2025.
Thank you again to everybody for attending this year's partnership in Quebec City. I'm really looking forward to seeing the practice of what we've discussed over the next few years as we roll out our connected care plan together.
Thank you, Marcel, for that beautiful and grounding opening prayer. And thank you, Michael, for the welcoming remarks. And for the folks who put together that video. Pretty cool. I really liked it. Together, you've set a thoughtful and motivating tone for what promises to be an exciting and impactful 2 days.
All right, we're now going to turn to patient family caregiver recognition. We would like to take this moment to recognize the unwavering commitment and essential impact that patients, families, and caregivers have and will always have on the Canadian healthcare system. Canada Health Infoway pledges to continuously listen to the perspectives and learn from the lived experiences of patients, families, and caregivers to ensure respectful collaboration in the work that we do and influence. We look forward to building true partnerships and acknowledging shared successes. So we would also like to specifically thank this year's patient advisors who helped shape the program for 2025 and bring it to life. Infoway is proud to remain a Patients Included conference and are forever grateful to our patient, family, and caregiver partners. So I'd now like to welcome to the stage one of this year's Patient Scholarship winners, Harjeet Kaur. I met her last name. There she is. Come on up. We'll just get that.
Should we just go?
Yeah.
Good morning, everyone. I'm Harjeet Kaur from Calgary, Alberta. Originally from India, I was diagnosed with stage 4 rare blood cancer back in 2019, named subcutaneous panniculitis T-cell lymphoma with HLH, ultra rare. And I had my stem cell transplant during the peak time of COVID in April 2020. Today, I wear many hats as a patient partner, advocate, speaker, digital creator, and also a co-founder of Chai and Hope, a peer support community for South Asian patients and caregivers. We created this because when I was diagnosed, I couldn't find a single person who shared my cultural background or understand the unique barriers faced by South Asian immigrants navigating cancer. In my South Asian communities, cancer is a huge stigma, hidden or treated like shame. That silence is dangerous, and it isolates too many people going through this journey. That gap, that stigma, showed me exactly what was missing. My journey began with 3 months of uncertainty, and my only symptom was constant high fever, ranging from 39 degrees to 42 degrees Celsius, that no one could explain. And I was in hospital for 2.5 months, treated as a research patient, had endless biopsies, surgeries, scans, you name it, I had it, but no one had any answer to it. As a new immigrant who came to Canada in 2018, dreaming of building a career and starting a family, I suddenly found myself lost in a new healthcare system, facing cultural barriers and then spending 35 days in complete isolation during COVID for my stem cell transplant, with no one around me. Those days were some of the hardest days of my life. No caregiver, no family, just the fear of not knowing if I would wake up the next morning. I still get nightmares from these moments. But today, I stand here 5 years post-transplant, celebrating life every single day. My younger brother, my donor, gave me this second chance in life, and I call it my rebirthday on 14th of April, 2020. Cancer took a lot from me, not only my hair, my career, my right eye vision, also 40% of my hearing and fertility loss at 32, which no one actually told me about. I was pushed into perimenopause without anyone prepping me for how it would affect my future and quality of life. But then I made myself a promise. If I survived, I would turn my pain into purpose. So no one has to walk through this journey all by themselves or alone. That purpose began through storytelling. During isolation, I started sharing my journey on Instagram at the rate HK_Thriver, not only for attention, but because I felt completely alone with a cancer so rare that only 150 cases exist worldwide and not a single one in Canada. I wanted to find someone who understands, especially because my team had never treated a case like mine in Canada, and it could not tell me how much life I had ahead of me. What I didn't expect was how many people I would end up helping. Messages started coming in from people saying, I thought I was the only one. I was told to hide my cancer, but your story gave me courage. And then 3 people reached out to me, one from Malaysia, one from UK, and one from US, with the exact same cancer. They found me through my digital space, and one of them even through ChatGPT. For them, I became the person I desperately needed, someone who understands, someone who survived, someone who could say you're not alone. And since I've been speaking openly about my journey, I realized something powerful. Breaking silence breaks stigma, and breaking stigma saves lives. That's when it clicked me. Storytelling is just not emotional. It's transformational. It's advocacy. It pushes system towards better change. It brings visibility to people who are unseen and unheard. Today, I'm proud to serve as a patient partner and advocate with Healthcare Excellence Canada, Canadian Cancer Society, Lymphoma Leukemia Society, and I'm also a patient family advisor for New Hospital Arthur J. E. Child Comprehensive Cancer Center in Calgary. I've been involved with multiple national and global organizations. I've done collaborations through my social media platform. My work focuses on bringing the gap between system and people, because patients are not just participants. We are partners. We are experts in our lived experience, and we deserve a seat at every decision-making table. Equity, representation, and cultural understanding are not optional in healthcare. They're essential for safe, effective, and compassionate care. When diverse voices are included in research, treatment, and policy, we don't just improve systems, we improve outcomes. My hope today is simple, that through collaborations like these, we continue building a healthcare system where every patient, regardless of background, color, cultural, language, or diagnosis, is seen, heard, and valued. A system where patients are not just recipients of care, but collaborators in care. If you would like to connect and collaborate or learn more about me, I would love to meet you during the conference. And thank you for giving me this space today to share my journey. Thank you.
Thank you so much, Harjeet. Thanks for sharing your story and reminding us that there's a human side to everything that we discuss here at Partnership.
Harjeet's story reminds us that behind every innovation are real people and real experiences. With that in mind, let's make sure you have everything you need to navigate the next 2 days with ease. The 2025 Partnership Conference strives to be paper-free, which means no printed programs. Instead, all of the information you need is located in the mobile event app, Apple or Android options. If you have any questions about accessing the app, please see our staff at the registration desk. You're encouraged to use the app to follow along with the program. Take advantage of translation and simultaneous interpretation options. Identify where and when you want to go somewhere, and also connect with other attendees, which is we should have probably put that at the top, actually, now that I think about it. And also a big thank you to Tally, who's sponsoring the mobile event app this year.
Very good. So as a reminder, I think you've already seen here, our plenary sessions will be in English or French, and you can access the simultaneous interpretation services through the QR code there.
Krista, if we wanted to relax or take a break, where would we go?
Yeah, we could do that. Funny you should ask, Edwin. For those interested, you can access this year's Wellness Lounge in the Salon Rose Room. Thank you to Bayshore for sponsoring the Wellness Lounge this year.
And a huge, big thank you to all of our sponsors, because great partnerships, like great data, are best when shared. So folks, take a moment to connect with them during the networking breaks and at this evening's industry showcase.
So I'd now like to welcome to the stage Dr. Peter Vaughan, Chair of the Board of Directors at Canada Health Infoway. Dr. Vaughan, well, he told me to keep it short. So, but he's had a distinguished career spanning medicine, public service, and digital health leadership. As a former physician and Deputy Minister of Health and Wellness in Nova Scotia, he's been a longtime advocate for innovation and patient-centered care. Please welcome Dr. Vaughan to the stage. Grab the other paper.
Made it. Bonjour tout le monde. Bienvenue au Québec pour la conférence de le partenariat 2025. Merci à tous et tous de vous être déplacés pour les 2 prochains jours. Je me présente, pour ceux qui ne me connaissent pas, je suis le Dr. Peter Vaughan en français. Et j'ai l'honneur d'être le président du conseil d'administration de Infoway Santé du Canada. Throughout my career, and it's been a long one, I've had the privilege of working alongside many of you, many dedicated Canadians, to improve how care is delivered and experienced. It's a pleasure to be here today with so many leaders and innovators, clinicians and patient partners who share a common purpose: improving the health of Canadians through the power of digital connection and collaboration. Over the years, I've seen firsthand that collaboration can drive real change. It's what allowed us to move from paper to electronic, and now from digital silos to connected, interoperable care. The past year has been one of profound momentum in Canada's digital health journey. Across jurisdictions, we've seen renewed commitment to interoperability and secure data exchange, ensuring that health information can follow patients wherever they receive care. Clinicians are adopting new innovations and digital tools like AI-assisted documentation that help reduce administrative burden and give back time, as you've heard, letting providers rediscover their love of practice. Our vendor community has shown remarkable leadership, developing and testing interoperable solutions that align with pan-Canadian standards and meet the needs of both patients and providers. Patients themselves are taking a more active role than ever before, advocating for access, transparency, and the ability to manage their own health information. As Canada's digital health agency, Infoway has contributed and continues to play a vital role in the convening partners and catalyzing progress. This past year, initiatives such as you've heard about, the AI Scribe, have shown how responsible innovation can support clinicians and improve efficiency. And through initiatives like the Centre for Clinical Innovation for Digital Health, Infoway has continued to champion co-collaboration and investment in the clinical leaders and learners who are shaping the future of connected care. As we look forward to the year ahead, we have both an opportunity and a responsibility to build on the foundation we've created and to keep driving forward to a truly interoperable, sustainable, and equitable health system. The work before us now is not only about digital transformation, but ensuring that every Canadian, no matter where they live, have access to safe, high-quality, connected care.